Good afternoon, ladies and gentlemen. My name is Nirav Shah, and I'm the director of the State of Maine Center for Disease Control and Prevention. I'm joined today with Governor Janet Mills as well. And we'd like to provide an update on the COVID-19 situation across the state. Today's update begins, again, on a sad and somber note. Maine CDC is aware of and reporting 3 additional Maine people who have passed away with COVID-19. One was a woman in her 70s from Waldo County. The next is a man in his 70s from York County. And third, a woman in her 80s, also from York County. These passings happen on a day when there are over 640,000 cases of COVID-19 in the United States, including over 31,000 deaths nationwide. As always, this is an important time to remember that even though we talk about cases and numbers which are sometimes staggering, each and every one of these cases is an individual and a person. And as to these 3 individuals in Maine who have passed, we, all of us, extend our deepest condolences to the family members during this time of grieving. Overall, Maine CDC is reporting 796 cases of COVID-19 across the state, an increase of 26 cases since yesterday. There are also 130 individuals who have been hospitalized, an increase of 4 since yesterday. At present, there are 27 individuals in Maine who are hospitalized in regular beds with COVID-19 and 20 who are hospitalized in ICU beds. And at present, 7 individuals right now are on ventilators in Maine with COVID-19. All told, there have unfortunately been 27 individuals who have passed away since Maine CDC began our COVID-19 activation. And 333 individuals have recovered, an increase of 28 since yesterday. We've also been keeping close tabs on the emergence of community transmission across the state. And today, Maine CDC is now able to confirm that community transmission is occurring in Androscoggin County. This is now in addition to Cumberland, York, and Penobscot counties. To date, there have been over 4,900 consults fielded by Maine CDC epidemiologists and medical staff since we began our work around COVID-19. I'd like to now provide a brief update on the now 5 outbreaks that Maine CDC is tracking and providing guidance for in long-term care facilities across the state. One is the Tall Pines facility in Waldo County. In total, there have been 35 individuals, both residents and staff, affiliated with that facility who have tested positive for COVID-19. This represents an increase of 10 since yesterday. The bulk of those 10 new cases are among residents, where there are 8 additional cases and 2 additional cases among staff. Next is the Cedars facility in Portland, where there have been a total of 5 cases, 3 among residents, 2 among staff. We're also awaiting testing on a large number of specimens that were sent to our laboratory here in Augusta. Those tests are actually being run right now, and we anticipate having results by tomorrow. The next facility is the Maine Veterans Home in Scarborough. All told, there are now 41 cases among residents and staff affiliated with the Maine Veterans Home, an increase of 3 since yesterday. And that increase is comprised of 3 additional cases among staff members. As we've talked about during these meetings, we've recommended universal testing across these facilities. This morning, we received results of a separate unit within Maine Vets that had tested and each and every one of the samples in this unit came back as negative. This is a testament to what quick, concise, and data-informed infection control practices can do during an outbreak setting and prevent that outbreak from spreading across a facility more widely. The next facility I'd like to discuss is the Augustus Center for Health and Rehabilitation, where there are now a total of 70 cases, an increase of 1 since yesterday, and that increase is in a staff member. All told at Augusta Rehab, there are 45 residents who have tested positive and 25 staff members. Just a few hours ago, Maine CDC became aware of another long-term care facility, and we are beginning the process of our investigation. This is a facility called Falmouth by the Sea, where we were made aware of 3 residents and 1 staff member who have tested positive for COVID-19. As per Maine CDC's Vanguard protocol, the protocol that other states are just now implementing, we immediately dispatched a shipment of PPE to the facility, and that shipment is on its way right now and is likely to arrive any time now. And what we dispatched to them were 1,000 surgical masks, 1,000 nitrile gloves, 36 double XL gowns, 60 extra large gowns, and about 50 face shields. This is our standard protocol anytime we are made aware of a COVID-19 situation in a congregate care setting. We now begin the work working with our infection control team, epidemiology team, and clinical team to assess their needs, provide PPE, and make sure that they have the latest scientific guidance on how to keep other residents safe. As we've seen from other facilities across Maine, it is possible to limit the spread of COVID-19 outbreaks if quick, strong, and scientifically grounded action is taken. I'd like to next provide a quick update on our overall activities involving PPE distribution. As of this morning, our current inventory for PPE encompasses over 56,095 masks, approximately 140,000 surgical masks, 26,000 face shields, approximately 227,000 gloves, about 3,400 disposable protective suits, also known as Tyvek suits, and about 10,000 surgical gowns. Yesterday, Maine CDC, working with our colleagues in the National Guard and the Department of Transportation, pulled, packed, and shipped over 40 orders for PPE, the bulk of which are currently going to congregate care settings, such as long-term care facilities, because of the increasing number of cases we've been seeing there. All told, since Maine CDC began its distributions of PPE, we have sent orders and fulfilled orders for 933 distinct institutions. Please note that this includes several institutions that have received multiple orders of PPE as they found their way going through the COVID-19 situation. And we are, of course, continuing that work. And I'd like to just take a moment to thank our colleagues at the National Guard as well as at the Department of Transportation. They have been on call with us 24 hours a day, 7 days a week, standing by to make quick shipments of PPE when facilities are in need. They're like the FedEx of Maine, and because of them, we've been able to get PPE to facilities as soon as we learn of a COVID-19 situation. In terms of critical resources and assets that we track, as of right now, there are a total of 319 ICU beds, of which 158 are available. There are also a total of 344 traditional ventilators, of which 313 are available. And there remain approximately 240 alternative ventilators available across the state. Before I turn things over to Governor Mills, I'd like to just take a moment to expand on some of those numbers. One of the things that we know about outbreaks is that they are, in a sense, a stress test on the healthcare system. And they don't create cracks in the healthcare system so much as they do reveal them. And in these discussions, we and others have talked a lot about this business and this concept of flattening the curve. You've certainly heard folks, including me and Governor Mills, talk about the need to flatten the curve as much as possible. And flattening the curve is based on this idea that there's a line, and above that line, that's when the healthcare system could get stressed and overstrained and not be able to care for everybody in Maine. That line represents the total capacity of the healthcare system. And when we talk about flattening the curve, what we're really talking about is pushing that curve down below that line so that whenever we reach the peak of the outbreak, the healthcare system has not been overstressed so that the healthcare system can continue to provide care for Maine people. That's why we want to flatten that curve. We want to push it below that line. But an equal and just as important part of our work is not just to flatten the curve, but to raise the line, to expand the capacity in the healthcare system so that no matter when that curve, no matter when that curve hits its peak, there's still enough capacity in the healthcare system so frontline healthcare workers can still take care of Maine people. And so I'd like to take a moment right now to just talk a little bit about the work that has happened, not just to flatten the curve, but to raise the line. And there are two ways that we raise the line in the healthcare system: staff and stuff. I want to first talk about staff. One of the things that we have been working on is to try to recruit as many additional staff who could work in the healthcare system to provide for an expanded capacity, no matter when that curve hits its peak. Again, trying to raise the line. And one of the ways that we've done that is through a system called Maine Responds. This is a core of volunteers, each and every one of you who's watching. Volunteers of people in Maine with specific medical skills who have signed up at the maineresponds.org website and said, I would like to join the healthcare force to help raise that line. Since January of this year, we have nearly doubled the number of volunteers in the Maine Responds database to now over 2,600 people, 2,600 people. The bulk of those individuals are nurses, but there's also behavioral health specialists who can help out in times of crisis, EMTs and paramedics who are on the front lines of the front lines taking care of people in emergencies, respiratory therapists who can operate ventilators, and physicians and physician assistants who can provide clinical care and guidance. Since January, we have nearly doubled now to 2,600 people, the number of people in Maine Responds who have said, if needed, I would like to help. Now, this speaks more about the character of Maine people than it does anything else. That when we have asked you to serve so that we can raise the line, people in Maine have done so. So that's the staffing piece of raising the line. But there's also the stuff, the physical things that we need to expand the capacity in the healthcare system. And I'd just like to pause and provide a couple of numbers on those. One is the alternative ventilators that we've discussed. There are now 240 alternative ventilators that are available should we need them. That's one example of how we've raised that line to increase capacity. The other are ICU beds. And here I'd like to just take a moment to commend hospitals in Maine. Since we've begun working with hospitals around COVID-19, hospitals in Maine have raised the line for ICU beds by at least 193 beds that are available as surge capacity if needed. Every single entity in Maine is doing its part. Each and every one of you watching has been able to contribute in some way. The bulk of you by staying home, helping flattening the curve. But a lot of people in Maine have also responded by signing up to volunteer. Hospital staff have helped us convert unused rooms to ICUs and have taken ventilators and made them available on this alternative basis. All of this has helped us significantly raise the line so that whenever we hit that peak, whenever that may occur, there's sufficient capacity in the system so that healthcare providers in Maine can continue keeping everyone in the state safe. And so I would like to personally thank everyone for those efforts. Flattening the curve is still important, but raising that line is just as critical. Thank you very much, everyone. I'd like to turn things over to Governor Mills.
Thank you, Dr. Shah. I, too, would like to thank the people of Maine, as always. It sometimes brings tears to my eyes to learn of the acts of generosity that we hear about every day, and so many more that we don't hear about, I know, that are occurring. And yesterday alone and today we received shipments from various sources of valuable PPE, from sources as disparate as ND Paper, Poland Springs, and the state of New Hampshire, thanks to Governor Sununu. But today I want to talk about something a little different. And I know this is hard on everybody, what we keep telling you and asking you to do, and you are doing. But it's the only way to get back to life as normal. And that is to do our part and stay apart so that we can, together, defeat this virus. Today I ask you to continue to do that. Stay the course. Stay home to save lives. Here are some new steps I've taken today and yesterday to make sure people can stay home, stay healthy at home, and that Maine businesses can keep their storefronts alive. By executive order today, I signed today, we are limiting evictions during this state of emergency. Taken together with the court's order, the Judicial Department's order that closes the courts for most proceedings, we will have basically prohibited evictions of almost all sorts. The order that I've signed applies to commercial ventures as well as small businesses and homes and rental apartments. We are also in this order strengthening the penalties against landlords, property owners who try to evict somebody unlawfully, turning off their electricity or changing the locks on the door without going through the lawful process. And we've extended the time frame for the eviction process once it does kick back in, once the courts reopen, if they reopen before the state of emergency terminates. We'll keep assessing this situation and assessing the court's actions to determine what additional steps may be necessary. With respect to rent, today I'm also announcing the establishment of a rental assistance program that I've been working with Maine Housing on for a week and a half now. This program is for Maine people who can no longer pay their rent due to unexpected financial circumstances caused by COVID-19. We have put together a fund of $5 million, a COVID-19 rent relief program. Each household that meets a certain income requirement may receive up to a one-time payment of up to $500 in rental assistance that'll be paid directly to the landlord, in exchange for which the landlord agrees to forego eviction for that month. Maine's community action agencies, 10 of them across the state, will administer this program locally and put the money out the door. They also have other resources that you may want to check into for other needs. The funding for this program, this short-term program, comes from the Housing Opportunity for Maine Fund, the Home Fund, partly generated by the large amount of real estate transfer taxes received last year. And this money will go entirely to the Maine people who are served. I want to thank Dan Brennan, Executive Director of Maine Housing, and Deputy Director Peter Merrill, and the Maine Housing staff for their work getting this program up and running very quickly. We all recognize this funding is not enough. It won't go a long ways, but it'll provide some measure of relief for a number of families for now. The program is effective now, today, and you can find applications and materials on the program at www.mainehousing.org/COVID rent. mainehousing.org/COVID rent. In addition, today I have sent letters to all the financial institutions in Maine, the banks, the credit unions, to ask them, urge them to help homeowners who are struggling to pay their mortgage because of COVID-19. You may know on March 27th, President Trump signed into federal law the CARES Act. Part of that act imposes a foreclosure moratorium on federally backed mortgages. In my letters to the local banks and credit unions, I am urging them in the strongest terms to avoid initiating residential and commercial foreclosures and to pause any foreclosures that may be in progress. I'm urging them to refrain from mailing notices to cure to Maine residences and Maine businesses as long as this current federal moratorium is in effect, and to continue to work with all borrowers, all customers in a proactive way. I have spoken with many of the banks and the credit unions and landlords associations and Pine Tree Legal, and all of them are working together to minimize the economic effect of this crisis on homeowners and renters and small businesses. I've directed Will Lund, Superintendent of the Bureau of Consumer Credit Protection, to issue similar guidance to out-of-state mortgage servicers. Our credit unions and our banks are a vital part of Maine's economy. Now I am asking them to step up, lend a helping hand to all those in need. These steps are aimed at ensuring people can stay in their homes because we've told them, stay in their homes. They got to have a home to stay in. And these actions build on previous actions we've taken towards that goal. On March 31st, I issued an executive order for emergency applications for general assistance, which is mostly housing vouchers that go to landlords to pay the rent for people who cannot afford it. We also amended the requirements for the Bridging Rental Assistance Program, or BRAP, beginning on May 1st, so we can help those clients with serious mental illness, including many who have substance use disorders, help them obtain transitional housing and stay home. You know, an author once said, if you asked him to name the importance of a house, he'd tell you the house shelters daydreaming, the house protects the dreamer, the house allows one to dream in peace, and today the house allows us to stay safe and healthy. Homes are a lot more than bricks and mortar and beams. The home is where my husband and I raised our 5 daughters. It's where we sat at the kitchen table and helped with homework, paid bills, ate meals, where we slept safely each night and dreamed of a bright tomorrow. It is my hope that these actions we've taken today will provide some sense of relief, both financial and emotional, to Maine people struggling to make ends meet. These actions will also help mitigate the spread of the virus by allowing Maine people to stay healthy at home. Many people ask, how can I help? Maine Responds is one way for those with health care credentials. Another way is for all of us to give blood. give blood, and visit www.redcrossblood.org to make an appointment safely to give blood to help those in need. So while we dream of a brighter tomorrow where we can all be together again, today we do our part and stay apart. Today we stay healthy at home. God bless all of you and keep you safe, and God bless the state of Maine. I think we'd both be happy to take some questions now.
Great. Thank you very much, Governor Mills. Today's first question comes to us from Ashley Blackford from WAGM. Go ahead, Ashley.
Thank you, Dr. Shah. You mentioned the other day that hospitals are documenting how many presumed cases they have that they're not testing. Can those numbers be released?
Yes, we can provide those for you. To repeat Ashley's question, we ask hospitals to report to us a number of pieces of data every single day. The number of beds they've got, the number of ventilators, the number of patients they have with COVID-19. One of the other numbers that we have, and we're happy to get for you, Ashley, is the number of individual patients in a hospital who the hospital believes might have COVID but doesn't have test results on yet. Generally, I always just like to present the confirmed numbers rather than the presumed or suspected numbers, but we have those numbers and we have no opposition to sharing them. So Robert Long will get those for you, Ashley.
Thank you very much.
I'd like to turn next to TJ Tremble from ABC7. Go ahead, TJ.
Good afternoon, Dr. Shah. Can you tell us if and when the alternate care sites have been set up, and if they haven't been yet, when they will be?
Great. So TJ's question here is about the alternate care sites and where we are in that process. And our posture right now with respect to the alternate care sites is that we are prepared for quick deployment of them should we detect a spike or an increase in that curve. If we're not successful in flattening that curve, we will be ready to erect those and make sure they get staffed up. Right now, the alternate care sites are at their staging areas at undisclosed locations close to where their eventual goals or their eventual locations would be. And we've moved them to those areas with the help of our colleagues in the National Guard and the Air Guard. And so that's where they are at this moment. But in conversations with our partners in the hospital system, as well as in the clinical medical system, there has been a preference to try to keep as many patients as possible in hospital care, as opposed to in an alternate care site. And given the fact that where we are right now is underneath that red line, we're underneath that line because the curve is not where because we've been able to raise that line that I referred to, that metaphorical capacity line, we're not at the point yet that we've needed to deploy the alternative care sites. You bet. But I just want to emphasize, we stand ready to do so if the situation warrants it, if the data tells us that's the direction we're going. Again, our posture is that we are ready to be ready. We're prepared to be prepared to do so. I'd like to turn next to oh, go ahead, TJ.
Could I address a question to Governor Mills?
Absolutely. Maybe.
Governor.
What you got?
I'm a conduit on this one. We've gotten a question from a local hairstylist, and maybe this should be directed to the Department of Labor, but you tell us if that's the case. She's self-employed, forced to close down, and she hasn't gotten any help at all with unemployment, and written letters, called, still no answers. What should she do?
I think the answer is we're still waiting for federal guidance on the aspect of the CARES Act that allows unemployment for self-employed individuals. So a lot of the other parts of the unemployment laws, the new state and federal laws, have been implemented. I think we put something like $45 million out the door just recently for unemployment benefits, but that particular part has not yet been implemented because we don't have final guidance from the feds.
Great. Thanks, TJ.
It will be retroactive to the time of eligibility.
I'd like to turn next to Steve Missler from Maine Public. Go ahead, Steve.
Hi, thanks for taking the call. I appreciate it. A quick question, Governor. Two, actually. One is I received a question from a reader or listener about whether the EO applies to commercial rentals like retail stores, or is it just for residential dwellings? And then the second question I have, which is from me, is that I think in about 40 minutes or so, the president is holding a conference call with governors. I guess my question is, do you plan to participate in that? And if you get the opportunity to speak, I guess what do you want him to hear from? What do you want to say to him? What's at the top of your list?
If I don't get any more questions before 3 o'clock, I will be on that call. Yes. Yes. I never know what he's going to say. This will be the 8th or 9th call the governors will have had with the vice president and oftentimes with the president as well. So we will continue to press for more testing, more equitable distribution of testing materials, testing kits. That's pretty much a consensus of all the governors. We all need that. It is step one in maintaining public health, and it is step one in beginning just thinking about turning around the economy. Testing is vital. And you yes about commercial. Yes, the executive order applies to Title 14, which is both commercial and residential evictions.
Great. Thanks, Steve. We'll turn next to Kate Koff at the Ellsworth American.
Thank you, Dr. Shah and Governor Mills. I'm wondering, Dr. Shah, can you talk about why the percentage of healthcare workers who have tested positive appears to be, fairly high, even higher in some instances than areas of the world that have been really hard hit? And I'm wondering, if Maine is taking any lessons from Singapore or other places. I think in Singapore, standard surgical procedures seem like, hand hygiene and surgical masks seem to be preventing widespread transmission among healthcare workers.
Great. Thanks for that question, Kate. Kate's question is about the percentage of individual cases in Maine that are accounted for by healthcare workers. And Kate, I respectfully disagree with one of the premises in your question, which is that our numbers are higher. Actually, just to recap the numbers, there are 173 healthcare workers in Maine who have tested positive for COVID-19. Of our 796 cases, that's about 21%. Just the other night, the U.S. CDC published a paper, and I'll try to post a link for this to this paper shortly. But the U.S. CDC published a paper in their journal looking at the same question: what percentage of all cases in the United States of COVID-19 are accounted for by healthcare workers? And what they found was that it was just under 20%. And so Maine's numbers are very much in line with those that we've seen across the United States, and I believe the CDC began collecting their data in March. So since the beginning of COVID-19, not just in Maine, but across the country, approximately 20% of cases have been in healthcare workers. And Kate, you noted, what have we learned from that? Well, we've learned quite a bit. It certainly underscores the need for rapid testing of healthcare workers, as well as to ensure they've got the PPE they need. It's among many of the reasons why we're speeding deliveries of PPE to long-term care facilities, nursing homes, not just to keep the residents safe, but to keep the staff safe. Because if there's not enough staff to work in those facilities, then who's going to take care of our parents, our spouses, and our siblings? But it is always a good opportunity in this situation to again ask you to thank every single healthcare worker that you know in your life. Every single day, while many of us are staying home, they're doing the opposite and going to the front lines in order to keep everyone in Maine safe. And after all this is over, we will undoubtedly owe them a debt of gratitude for the risk that we know they've taken. So thanks for that question, Kate. I'd like to turn next to Eric Russell from the Press-Herald.
Thank you both. This question's for Governor Mills. I know there's been a lot of discussion about how and when to reopen the economy, even gradually. It seems like public health experts have been saying that there are three critical components that are needed: a 2-week decline in cases, widespread access to testing, and then major track and trace systems. And I wonder if you believe that those components would have to be in place before Maine can reopen.
Well, another item is the availability of PPE. Generally speaking, we have to prioritize the distribution of PPE right now. We'd rather provide it more universally. We're providing as much as we can where we can to minimize the exposure. No, those are part of the factors, part of the criteria. As I said the other day, there's no data point that says, okay, now you can reopen beauty salons or now you can reopen beaches. And this is something I'm talking with my counterparts in other states about as well. We're pretty much all on the same page. This is a public health issue. The economy and public health are closely intertwined. So people have asked me, can't you open some golf courses? Can't you open some beaches? And I know that if we were to open the beaches in southern Maine, as much as I'd like to go out on the beach this long weekend, if we opened ours, Massachusetts hasn't opened theirs, New Hampshire, as skinny as their beach is, has not opened theirs. All those people from Massachusetts, from a hotspot, a determined hotspot, would come here to go to our beaches or go to our golf courses right now. So we're trying to do this in a coordinated fashion, one step at a time. What is the way to do business, open up businesses with minimal or no public health risks? I am excited about how so many businesses are sort of reinventing themselves these past few weeks and how they have looked outside the box to say, how can I make money? How can I serve the people in a different way? How can I sell insurance without a lot of public contact? How can I sell a car? How can I teach dance lessons online? I mean, it's fascinating. People are creating new ways to do business, and there's going to be a lot more of that in the weeks and months to come.
Thank you, Eric. I'd like to turn next to Dustin from New England Cable News. Go ahead, Dustin.
Hi, Dr. Shah and Governor Mills. This is for the governor, not on COVID-19, but what's been your action on the Mills situation in Jay and what you've been doing to monitor? Have you been on any calls? Is there anything new you can tell us about that?
Sure, just that I've had several calls with the mill manager, the former mill manager, the current mill manager. Some of the people are arriving today. We've been making arrangements for them because they're coming from out of state, making arrangements for them to stay safely with all due consideration to the public health issues and to assess the damage. I have said that we will do whatever it takes on our part to help them find another supply of pulp in an economic fashion, to do whatever it takes to keep that mill alive, to bring it back to full steam, keep those people employed.
Great. Thanks, Dustin. And turning next to Amy Brown at WERU.
Thank you, Dr. Shah. This is a little bit of a follow-up on a previous question. If it's not yet known whether people who have recovered have immunity or how long it lasts, how is increased testing going to move us toward being able to return to work? And also, if we were able to somehow obtain enough N95 masks for not only healthcare but for the general population, would wearing those make people safe enough to return to sort of normal life?
So Amy raises two great questions about under what scientific conditions should we think about approaching returning to work? One is around testing. And Amy, you raised the question of to what extent, after someone has had coronavirus infection, are they immune to it? And, in science, there's different ways and different degrees of confidence with which we can know things. And in this situation, according to Dr. Anthony Fauci, everything he knows about viruses in general and coronaviruses in particular tells him that people do have immunity after they've had the virus. Now, he recognizes that there hasn't been a randomized clinical trial that's proven that, but based on everything he knows, he's got a high degree of confidence that once you've had it, even or been exposed to it, you're not going to get it again. And that is really where this antibody testing comes into play. The antibody testing, once it's available more widely, and right now it is not, but once it is, lots of people can get tested, and if it turns out that they have the antibody in their system, it means they can re-enter society, re-enter the workforce, and not worry about being infected or spreading it to somebody else. Amy, you raise a similar corollary question with N95s. If they were universally worn, would that be a way that we could start going back down the stairs? It's difficult to say, Amy. N95s are difficult to wear. They require a pretty comprehensive what's called fit testing in order to wear them properly. And once they're on, you've got to make sure you're not touching your face more and not adjusting it in such a fashion that that seal becomes loose. So it is a possibility, but it's probably one that's more viable just for healthcare workers as opposed to the general population. That being said, this is a situation that the world has never faced before, so all options remain on the table. I'd like to turn next to Caitlin Andrews from the BDN.
Good afternoon. I have two questions for the governor and one question for Dr. Shah. Governor, some of the money from the CARES Act is starting to come into Maine. What is the procedure for spending that money? Does it require legislative approval, and have any plans been made to begin looking at it? And do you have any guidance on whether universities should start planning for remote fall semesters, or is it too early to say yet?
Okay, lastly, it's too early. First question, there are several different tranches of money coming from the CARES Act. One, a small batch of money has come through to hospitals of various sizes in Maine and other states. 30 billion of the 100 billion designated for hospitals has been distributed, I believe. Now, where the rest of that will go and when it'll come out, I don't know. Secondly, there's been money for higher education. I don't know if that's been received yet. Thirdly, money for the states. We hope to be talking with the president about that on the phone call today. Money for the states. The Secretary Mnuchin on our phone calls insists that whatever money we get, whatever portion of that money, has to be spent to reimburse us for expenditures directly related to caused by the COVID-19 virus. And my commissioner of Administrative Financial Services, Christopher Groa, has been putting together the documents to support that request for money. And so my understanding is that money would come into the budget, to the state budget, to pay for those expenses that have already been paid out. So that would be sort of like getting any other federal grant. Does that answer your question?
I guess I just need a little bit more clarification. So once your administration gets that money, are they just able to reimburse themselves by how it's directed, or does that need to go through the legislature first?
I think it goes directly for the reimbursement to those agencies that have expended certain amounts of money, unexpected expenditures directly caused by the COVID-19 virus.
And Caitlin, you mentioned you had a question for me too?
Yes, Dr. Shah. This has been asked many times before, but I'm going to ask it a slightly different way. Is the state tracking COVID cases by zip code? And I understand the reasons for releasing it by county to kind of remind people of the importance of social distancing, but is there a legal reason that information cannot be released by zip code?
Well, it's a couple of things. So first is on the tracking, and we are able to get information based on the people we talk to themselves. Not everybody, when the health department calls, wishes to share every piece of information. Income, race, some of those things, folks decline to share. I don't know what percentage of individuals have declined to share their zip code. So we'd have to check on that so I could give you a more accurate answer on the tracking itself. But in general, Caitlin, we're always trying to balance the public's need to have information to protect themselves with our concurrent obligation to protect privacy. And when in a less populated state with not that many cases, revealing the number of cases per zip code could potentially reveal the identity of somebody with COVID-19. I think what you've seen in other states that have moved in that direction is that they've had tens of thousands of cases per zip code. Their zip codes have more people in them in some cases than counties do in Maine. And so we're evaluating that. We're aware that other states are moving in those directions, but we're also aware of these significant demographic differences between Maine and our counties and state as opposed to some of those zip codes. Manhattan being one example.
One more question?
Okay, sure thing. I think we've got time for one more question before the governor has to go. And so that question is next on the list is Kara DeRose from the Maine Beacon.
Thank you. So I just have hopefully one or two quick questions for Governor Mills related to the rent relief program. Just to clarify, is there a limitation in the rent relief program to only those whose economic difficulties have begun since the pandemic and not before? And has your administration started thinking about what it will do to help residents who may need more than just this one-time $500 payment or may struggle to pay rent even after the pandemic subsides? That's a lot, but
it's what we can do right now. It's what we can do right now. We've put this together kind of on the fly, found some money for at least a one-time payment towards people's rent. And the bargain is that the landlord accepting this partial payment or payment will commit to not evicting the person for that month that the rent is owed. On the other hand, long-term rental relief, no, we don't have a long-term plan for rental relief, but this is a start. It is what it is, and that plus postponing and preventing foreclosures and evictions is to keep people safe and at home right now. This isn't meant to be a long-term subsidy. It's meant to be a public health move to keep people home. So I have to go. Unless it's something urgent. Let me just end by, barely 3 weeks ago we stood here and we made the sad announcement of the first COVID-19 death. Shortly after that press conference, I get things that make me sad every day. You do too. I get things that give me some joy. This one brought me both sorrow and joy. And it was an email from the son of the individual, the first person who died of COVID-19. And he said, just a quick note to thank you and Dr. Shah for your kind words regarding the passing of Maine's first COVID-19 victim. He was my father. There's a long tradition in our family of public service in Maine. We are Washburns. Like you, Israel Washburn, my third great uncle, was governor of Maine during a national emergency, the Civil War. And today he wrote again to thank us both for acknowledging his father and his father's death. He said, "No, you don't know me, and I don't know you, but yes, we are family. We are Mainers, and I am so grateful." I pass that along to Dr. Shah and to all the people of Maine because we are all Mainers, and I too am grateful. Thank you.